Hello, everyone, and welcome to this audio podcast. As part of the Hilium Space edition. This audio podcast as part of a calibrated morphology, and this audio podcast as part of a Storm Robotics production. So, an intro looking at sort of hematuria and sort of testing to improve patient outcomes. So first and foremost, hematuria can be it's sort of a symptom or symptomology that can be sort of directly or indirectly linked to acute kidney injury or AKI, or sort of chronic kidney disease or CKD. But diagnosis is often hampered or hindered by the lack of clarity with regard to sort of description, analysis, and referral criteria. So in published works from sort of 2015, 2000 in around 2015, works published works looks at sort of the sort of the morphological basis and the morphological basis of investigation or laboratory investigation of hematuria. So a little bit in sort of around the intro. So the source, the basis and the reason for hematuria is often confused due to the lack of clarity over description, analysis, and patient referral and criteria, and a thorough sort of hematuria review had been carried out, and a result of the and as a result, sort of historically at least to some extent, the Renal Association or the RA, the Renal Association the RA, and the British Association of Urological Surgeons or BAUS formed a sort of a unity to agree on guidelines to update training of staff, providing guidelines to providing guidelines to sort of update in around the training of staff, providing care for patients or recipients presenting with hematuria. So urinary screening for hematuria should only be performed for sort of recognizable medical reasons, as there has been sort of little or sort of no evidence, for example, to support opportunistic basis for opportunistic or point of care testing or POCT for the general population around hematuria. So the nephrological aspects of analysis and control have been sort of covered by the National Institute for Health and Care Excellence, or NICE, chronic kidney disease or CKD guidelines, with which have also sort of replaced or had replaced sort of the existing UK Royal College of Physicians chronic kidney disease or CKD framework. This published works from 2015 sort of provides provides sort of an overview of hematuria, offering sort of a background basis and definitions in the context of chronic kidney disease or CKD, and some from a sort of primary care perspective. It is perhaps also important that sort of laboratory specialists, and particularly those in between, for example, microbiology specialties, and also in around hematology, sort of appreciate the general practitioner curriculum, or the Royal College for General Practitioners, or RCGP curriculum on hematuria, in around hematuria. So hematuria can be defined as sort of the presence or the basis of red blood cells or RBCs in urine in urine, either visible, where visible is referred to is macroscopic hematuria, or detected by direct microscopy, or under or linked with morphology, or where morphology is concerned, which can be referred to as which is referred to as microscopic hematuria. So substantiated numbers of red blood cells excuse me, of red blood cells have provided sort of the laboratory reference ranges used for the classification of microscopic or occult hematuria, with established definitions using values of more than three red blood cells. So that's more than three red blood cells within the within a typical sort of field with under microscopy under microscopy per high power field, or more than five red blood cells per high power field under microscopy. So hematuria can be broadly classified as having two specific sort of fundamentals. That is classified as either nephrological, where hematuria is directly related or in regard to the kidneys, or where the kidneys are affected, or urological, where the bladder and sort of the tract, the sort of urinary tract, is sort of directly affected in origin. Any glomerular disease at the same time may result in microscopic hematuria. Active glomerular nephritis and acute interstitial nephritis are associated with large numbers of usually dysmorphic, so dysmorphic meaning sort of the misappearance of red blood cells, of red blood cells under under morphology or microscopy, and where the appearance of red cells, where the appearance of red cells lose the concave sort of shape, where the concave shape indicates that red blood cells are generally oxygenated and carrying oxygen throughout general physiology. Dysmorphic meaning under microscopic or morphological examination, the red blood cells have a sort of a misappearance. So they have a misappearance, and they also have a sort of where the red blood cells have a sort of a tinge, which can also be sort of referred to as casts, sort of like a cast, where the dysmorphic nature of the red blood cells have again sort of have a misappearance. So other reasons for hematuria include number one, sort of non-visible hematuria, which is referred to as SNVH, and meaning sort of significant non-visible hematuria, which is connected to sort of the lower tract, or the lower urinary tract, and these can include sort of a reluctance to void. So what this means is, for example, patients or recipients, for example, they can have sort of a micturition, where for example where for example there's where for example the bladder wants to void, or where a person or individual wants to void, and where this terminology refers to micturation. And there's a micturation, or has that sensational micturation. However, there's a reluctance, because where an individual's tract owing to hematuria, the symptomology can cause a sort of can cause a sort of a reluctance and sort of inability, let's say inability owing to the hematuria causing sort of causing or contributing to the inability the ability so avoiding and then also at the same time this can include sort of a reluctance to avoiding frequency, avoiding desperation, or painful excuse me or painful avoiding a dysuria, um, and two and two sort of asymptomatic non-visible hematuria, which is referred to as NVH. Sorry, just to go back, SNVH is symptomatic non-visible hematuria, not significant. It's symptomatic non-visible hematuria, that's SNVH, and asymptomatic non-visible hematuria is referred to as ANVH, which historically and in some evidence in some evidence works amongst the literature, ANVH is a sort of a chance, or almost a sort of a chance or an incidental finding in the absence of lower or upper urinary tract symptoms or symptomology. So microscopic hematuria may also be detected in the absence of any underlying pathology, such as any under in the absence of any sort of underlying pathology where, for example, the sort of upper urinary tract and sort of parts and sort of the anatomy of the lower lean into the lower urinary tract can be affected, or the pathology can be affected owing to a strain on a sort of a strain on the tract in line with sort of where physiology or pathophysiology is concerned. So that draws this audio podcast to a close. This audio podcast sort of introducing sort of the basis around hematuria, looking at hematuria. This has been an audio podcast as part of the Hilium Space edition. This audio podcast is part of a Calibrated Morphology. This audio podcast as part of a Storm Lobostics production.